The kidneys are bean-shaped organ located at the rear of the abdominal cavity in the retroperitoneal space. If you are looking inside the kidney, you will see that it has an origin, the renal cortex, and an inner region, the renal medulla. The kidney has four main functions: excretory function, regulatory function, endocrine function, and metabolic function. First, let's talk about the excretory function. Excretory function involves excretion or removing of metabolic waste product eliminated in the urine, like urea, which is waste from protein metabolism, creatinine from muscle metabolism, uric acid from the breakdown of nucleic acid, bilirubin from the breakdown of hemoglobin, and some foreign substances such as drugs and toxins. In the clinical practice, in order to determine the functional capability of the kidneys, you have to take a look of the urea and creatinine level of the blood. But you have to know this very important point here. In the case of dehydration, when the patient is hypovolemic, you may find increase a level of urea in the blood, which is called uremia, whereas the creatinine level stays normal. The reason for this, as quoted in a popular medical textbook, is that there is increased reabsorption of urea by the kidneys. Again, uremia does not tell us that the kidney working properly. Therefore, blood creatinine level is the gold standard to determine the excretory function of the kidneys. The second function of the kidneys is regulatory function. First, the kidneys regulate water balance, meaning even if you drink more water will be removed from your body. Less water you drink, kidneys retain more water in the body, preventing dehydration. The second regulatory function is the control of electrolyte balance, like sodium, potassium, chloride, bicarbonates, calcium, etc., and of course acid-base balance. As for the endocrine function of the kidneys, the first hormone secreted by the kidneys is erythropoietin. This hormone is secreted by endothelial cell in protubular capillary veins. It is important to know that erythropoietin controls erythropoiesis or red blood cell production in the bone marrow. These cells are very sensitive to oxygen level of the blood. Under hypoxic condition, these cells produce more erythropoietin for the facilitating erythropoiesis. The second endocrine function of the kidneys is activating vitamin D. First, the parathyroid hormone acts on the proximal convoluted tubule cells and then hydroxylates 25% hydroxy vitamin D to form the active form of vitamin D. Vitamin D can act on kidney, intestine, bones to regulate calcium homeostasis. The third endocrine function of the kidneys is renin secretion. This enzyme is produced by juxtaglomerular cells. The juxtaglomerular cells are specialized small muscle cells mainly in the wall of the afferent arterioles and some in the afferent arterioles that deliver blood to the glomerulus. Renin regulates blood volume, blood pressure, and electrolyte balance. Finally, the fourth endocrine function of the kidneys is prostaglandin secretion. Prostaglandin are vasodilators and serve to contract primarily angiotensin-mediated vasoconstriction, acting at the level of the arterioles and the glomerular messenger cells. During acid trace deaths, the increase in sympathetic tone causes vasoconstriction of the afferent artery. The same stimuli activate a local production of prostaglandin. Prostaglandin leads to vasodilation of the afferent arterioles that modulating the vasoconstriction. The long use of such medications, like non-steroidal anti-inflammatory drugs, can block synthesis of prostaglandin, leading to constriction of afferent arteriole, decreasing renal plasma fluids, which is in turn decrease the glomerular filtration rate. This may result in acute renal failure. And finally, let's talk about the metabolic function of the kidney. The first and important metabolic function of the kidneys is ammoniogenesis, which has an important role in acid-base homeostasis. Also, during starvation, the kidneys has the ability to produce glucose through gluconeogenesis. And final question, please explain the reason for the occurrence of anemia in the patient with chronic renal failure.